So think big data, artificial intelligence, the Internet of Things. These technologies are influencing our world. Questions loom about what value they really bring to our everyday lives. The key, it would seem, to unlocking this potential is evaluating the balance between the human-centered and the performance-based technologies. As we look to address some of our most pressing social and environmental challenges, designing with people in mind allows us to better understand where we come from and where we can move forward together. So our first presenter in this theme is Peizhong Gao, an undergraduate student at the School of Design and Innovation, Tongji University, who is specializing in industrial design. He's won several scholarships and the title of Outstanding Student. In 2020, he participated in the Shanghai International Design Innovation Research Institute and the Digital Innovation Center of Tongji University. So please join me in welcoming Peizhong to the main stage.
Thank you, and thank WDO for giving me this opportunity to report our project on this platform. Hello, everyone. I am Gao Peizhong from College of Design and Innovation, Tongji University. The designers have been designing for humans and societies, but what if we are now designing for the unimagined? As Herbert Simon said, we should shape the future rather than forecast it. Facing an increasingly uncertain future, how can we show our attitude towards design? Furthermore, how to shape it? Last year, Tongji College of Design and Innovation, Tongji University, and GAC Research Institute co-founded the DNI GAC Incubation Camp, encouraging students to explore the power of design and the possible future. After 6 months of work, 8 design teams presented their outcomes on the forum named Mobile Theater as a part of Tongji Design Week, where distinguished guests from academia and industry were invited to a discussion open to the public. We rediscovered the power of design for preferable future and set our goal as knowledge-generating, design-oriented research. The main participants are not the researchers, but the designers. In the project, the process of design should be a reflective conversation or a dialogue, and the product should be an outcome of the dialogue. What we design will be the stimulus and the material to create the future. After this well-organized design education project, today I'm here representing our team to share our exploration on the power of design for the unimagined. Nowadays, technical approaches are influencing the world. What we can do is to evaluate the balance between human-centered and performance-based technologies. The trend is that humans will carry and wear more intelligent electronic devices. The energy supply of a large number of different devices will become an issue which needs to be attached great importance to in the future. At present, although small energy harvesting and storage devices have developed rapidly, they still lack the integration of intelligence, efficiency, inclusiveness, and sustainability, including the dynamic demand and interaction with people. Besides, as a distributed energy system characterized by the coupling of new technology and of energy and information, Jeremy Rifkin, the initiator of energy interconnection, described it as a distributed, open, and shared network based on renewable energy. With the attention of the Chinese government, in March 2016, State Grid Corporation of China initiated the establishment of the Global Energy Interconnection (GEI) Development and Cooperation Organization. The current research mainly discusses the macro energy interconnection, but there is likely to be a micro energy interconnection in the future as a part of GEI. Various small energy harvesting and storage devices have developed rapidly, and breakthroughs have been made in biotechnology, material science, physics, and other directions. Lewin et al. From the University of California, San Diego published a paper describing a self-sustainable wearable multimodular e-textile bio-energy microgrid system, which integrates the collection, storage, and utilization of personal energy into one system. With the maturity of Internet of Things, microgrid can not only achieve personal integration, but also realize and interact with the dynamic needs of people. The wireless power transfer technology provides a technical basis for the two-way flow of energy and information. There is no doubt that design-driven innovation will become an important method in this area. Therefore, we took the same standpoint of speculative design to build and simulate a human-based decentralized energy interconnection system based on IoT and wireless transmission technology. Energy flows and is allocated at the individual level and the crowd level, aiming to solve the energy supply problem of small equipment in the future. One part is about the speculative design of wearable devices of 5 different types, including capacitors for energy storage, mask and wearable vests for energy harvesting from sweat and heat, hand equipment for friction and power generation, and shoe accessories for pressure power generation. We explored the relationship between equipment modeling and body, and even used exaggerated ones to test the user's feelings. In the other part, the system and service design will be the core. We have encountered 4 main problems: how to distribute energy according to demand and supply it through other ways when some energy is inefficient. The second, how to manage redundant energy. Is it necessary to establish a platform to manage energy? And then, how to achieve energy mutual aid between individuals and the whole? And then finally, how to ensure the rationality of energy rights, similar to the rights of blood donors. In the context, in the concept of energy internet, a generalized coordinative operation model, generation, grid, load, storage was proposed. Applying this theory to microgrid, the generation includes a variety of energy resources. Grid includes power grid, internet, IoT, and other resource networks. Load includes power load and various energy needs of users. Storage merely refers to a variety of storage equipment and method. After the establishment of the system, we conducted user simulation and testing to provide the possibility for future iterations. Through the speculative design of human-based energy interconnection system, we gave some suggestions and believe that it has great design potentialities in the future. The first, the promotion of wearable microgrid needs designers to pay attention to the connection with fashion. The second, it is necessary to attach importance to the user-friendliness in technology application. Then, the impact of the development of blockchain technology is inevitable. Then, the management of energy is still the focus. A more perfect system should be designed. And next, ownership of energy may become an issue. Whether the energy generated through individual activities can be exchanged, and how to ensure the rationality of its utilization. Finally, sustainability should be kept through the whole design process so as to face energy and resource problems in the future. There are also some outcomes from other teams worth to share, such as mobility as Viscera, which explored the future possibilities of biology as urban decision makers, and dialogue attorney, exploring perceptual interaction and construct the cross-linking between natural mechanism and human senses. Design can sweetly depict a picture which can be discussed by others, to express arguments and could be a demonstration, so that the unimagined can be sensed. In this way, the result of design has become a platform for communication, enabling people to have a dialogue. Incorporating design-oriented research into undergraduate curriculum can stimulate students' passion for technology. It plays a potential role in human-centered technologies for social and environmental benefit. This is why we believed in the importance of design for the unimagined. Thanks a lot. I'm finished.
Thank you, Peizhong. It's so interesting to see your research across such a great number of devices, IoT, complexity, et cetera. It was very impressive how in the end you said your research is really all about human experience, human feelings, user performances, and as you said, I think in the end, how the unimagined actually can be sensed from a human perspective. So thank you very much for that. We're going to have you stand by for a moment and we'll bring you back. But first, we're going to now move to our next presenter, actually, a set of presenters. So we're very thrilled to welcome three dynamic and experienced presenters from IBM India. Ekta Jaffrey is a design director, thought leader, and coach at IBM. She's designing the future one step at a time with multiple successful products in the market. Ekta is also a sustainability advocate and a data privacy activist. Priyanka Pillai is a senior experienced designer at IBM who currently works as a researcher, designer, and facilitator for cognitive power systems. As a practitioner, she's very interested in exploring the intersection of technology and design as it holds tremendous potential to create inclusive, accessible, and immersive experiences. And finally, Nisha Rangdal is a UX and service designer at IBM who currently works towards designing the interface and user experience for AI-powered applications. She believes in design and it shifts the mindset, inspires empathy, and caters towards all living beings. Let's have a listen now to our team from India.
Great. Thank you so much for the opportunity. We are Team Uma, and today Ekta, Nisha, and I will be presenting how we went about designing this product within the ecosystem that we did. We'll be covering our research, our product, and why it's important to design for culture, a diverse group of people, and a country like India. So we can start now. Nisha?
Yeah, you can start.
So imagine this. Poonam is a young woman in rural India who's just found out that she's pregnant with her first child. Now, shock is just the first emotion she feels because the rest soon follow in a whirlwind. You have shyness, excitement, and even fear. At this moment in time, Poonam is in her bubble, unaware that the pregnancy involves more than just her body and mind. Now, Poonam is one of the many going through their pregnancy in a country where we're still fighting to reduce our maternal mortality rate. Over the last 20 years, 1.3 million women have lost their lives to fairly preventable pregnancy complications, and more so in rural areas. Now, one of the leading causes of death is obstetric hemorrhaging, which can be traced back to the delayed identification as well as management of these underlying medical issues, a very common one being anemia. Now, let's look into the prevailing conditions that have created this complex ecosystem as well as the unique barriers in Poonam's pregnancy. Now, India is a largely patriarchal society where gender bias exists in many forms, such as distinct gender roles, stereotypes, sexual violence, taboos about sex, etc. Women and girls are part of a system that routinely and functionally overlooks their rights, independence, and agency. This systemic structure is replicated in different capacities and scales, both within the healthcare system as well as within each family unit. Now, these structural barriers don't work in isolation. They kind of reinforce each other in a compounding effect. For instance, gender norms restrict the involvement of the father, which perpetuates gender roles and limits the pregnant person's agency and lack of a solid support system. Now, these gender norms also restrict the education of the pregnant person, which further limits the agency, access to accurate information, and the ability to communicate the details of their pregnancy to doctors. And finally, together, what happens is that these factors hinder the decision-making abilities of the pregnant person and perpetuates unsafe health practices. Now, let's break down Poonam's pregnancy journey in this complex ecosystem. Now, Poonam's pregnancy has been difficult from the very beginning, and she's under a lot of pressure. The pressure to keep working, to give birth to a male child, to follow the different pieces of advice she gets, all of which makes her forgetful of doctors' instructions. She's physically and mentally tired, and out of shyness and general intimidation around medical staff, she's also unable to tell them about any symptoms she's experiencing, or even if she's taking her medical supplements. This leaves her open and otherwise open to very vulnerable and preventable complications. Now, my colleague Nisha will take you through our service elements of our product and how Poonam will overcome these barriers.
Thank you, Priyanka. So Poonam's story is just one of many families, many pregnancy-related medical issues, and many preventable situations. While many of these prevailing conditions arise from cultural and situational barriers that we can't really affect at this point, we have identified four important areas of intervention. Firstly, we need to curate information that is sensitive to the pregnant person's context. So, for example, their economic means, their cultural beliefs and values, etc. Secondly, by communicating the positive impact following this information has on the pregnancy, we can inculcate a healthy attitude towards medical adherence, which results in healthier parents and children. By raising awareness on the danger signs to look out for and educating the pregnant person and their ecosystem, there is greater support and quality of care within the entire household. And last but not the least, in addition to eased communication with the family, the pregnant person would definitely benefit from facilitated communication with the medical staff as well. Most appointments are very rushed due to the large number of patients waiting to see the disproportionate number of doctors in the healthcare system, especially at the primary healthcare centers. This adds to the already existing gaps of language, education, and shortage of medical staff in India. Through our proposed service, Uma, Poonam is empowered with the tools to navigate her own pregnancy. Firstly, she is introduced to our service Uma through a video that plays at her first hospital appointment in the clinic. At her first appointment, the doctor gives Poonam trimester specific sticker sheets for her first trimester to put on the calendars for tracking. Poonam uses these stickers to track any signs of danger, her daily routine of taking her supplements, and also her next hospital visit. These stickers are illustrative and they do not usually require any literacy skills. Calendars are familiar objects that are found in every Indian household and are usually kept in common areas, so the entire family is now involved in her pregnancy journey. Her family, looking at the calendar, inquires after her health more often now. Poonam sometimes still feels scared and confused. From all of these stickers, there are two scannable stickers that lead Poonam to a playlist of informational videos. She scans one to know what to expect at her next hospital visit, and she scans the other to access informational videos on warning signs, nutrition, hygiene, baby's development, and precautions and care that are relevant to her. At her second hospital visit and all of her visits thereafter, Poonam takes her calendar on which she has pasted stickers indicating her health and adherence to medicine on each day. The doctor can understand more about Poonam's day to day condition by scanning the calendar through our Uma app, which reads the stickers and gives clear insights on Poonam's condition. Poonam is no longer worried if she has forgotten to mention anything to the doctor and is more comfortable at her visits as well. After each trimester, the doctor gives Poonam a new set of sticker sheets to track symptoms and habits that are pertinent to that trimester, which continues till Poonam has delivered her baby. Each major service touchpoint in Uma was designed keeping users like Poonam in mind, with technology being very consciously used throughout the entire service. As mentioned before, the calendars and our sticker sheets, which are our physical interfaces, are very visual and do not require any learning curve. Uma does not provide the calendars. However, households in India maintain their own calendars as per their culture and or religion, and the behavior of using it to track things like expenses, the lunar cycle, sunrise and sunset timings, etc., is already exists, which helps inculcate a mindset of tracking and being conscious of pregnancy-related factors amongst all the family members. The QR codes are our first technological artifact in the service. Mobile penetration in rural and peri-urban India is increasing at a very rapid rate. QR codes have a small learning curve. They are accessible through almost every smartphone device, and are a good means to spread relevant information to many users at the same time. The access to informational videos through the QR codes means that there is more access to medically accurate information, thereby improving pregnancy related literacy and awareness amongst our user group. And lastly, our app is reserved for the doctors. When doctors scan the sticker filled calendar through the app, it uses a marker based system to recognize the stickers and leverages optical character recognition, that is OCR, and machine learning to gather insights on the pregnancy and to represent these insights in a very simple manner. This helps to improve patient doctor communication and eases the doctor's time so that they can see more patients in the time period. My colleague Ekta Jaffrey will now be taking you through our design process and the impact that our service has created. Over to you, Ekta.
Thank you, Nisha. Yes. So, when we all came together, it was in the middle of the COVID outbreak, and all of us were home in our native places, deep in the Indian hinterland, in places like Udupi and Uttarakhand. Our team was perfectly poised to do very in-depth research, very close to the people, same people that we were studying. We interviewed over 70 participants in 8 different states in the maternal health landscape in India. We deep dived with SMEs and ASHA workers to learn the problems they face in healthcare delivery. We also understood the ecosystem of pregnant people and their ancillary support givers through participatory research. So, bringing that all together, next please, bringing that all together, that's a huge amount of primary and secondary data that we had to bring together. We looked at it from a service design and design thinking and systems thinking lens, using both frameworks very intimately integrated with enterprise design thinking, which is the methodology that governs basically everything we do. Um, so, unraveling of the complexity of this ecosystem brought us 3 different paradigms that had to change: the lack of medical adherence, gender bias in healthcare, and the lack of agency, which affects our user directly, Poonam, the pregnant mother. The root of all this was found to be in knowledge and education. Now, to create a repository of information and knowledge, and embody this service in a very comfortable aura, we created Uma. She crosses the accessibility gap by making information given by the doctor making more digestible for the user. The character of Uma is very inherently rooted in research. In our search of the ecosystem, we found a female significant other who a persona relies on and trusts a lot. And that is the voice of Uma. We've also iterated extensively on the product that touches Poonam's life, using an artifact that everyone in rural India has there in their home, the humble calendar. Our sponsor users could tactically see the service being embodied, and they provided very valuable feedback. Here's a clip from the field. Next.
Poonam isn't the only one worrying and anxious about her pregnancy. There are many like her facing the same anxiety. Uma can be an excellent pregnancy companion for expectant parents. Uma makes them aware of normal and abnormal signs and symptoms of pregnancy. Uma, through everyday calendar, helps them to record their symptoms and behavior and communicate to me when they come for checkup. Uma can make journey of pregnancy safer and a self-sufficient, confident would-be mother. A mother who can identify the warning signs herself and reach to her doctor. Uma cares for our mother and our mothers care for our babies.
Thank you, Nisha. To take this service forward, and to bring it alive, we're looking at a very tightly coupled concept testing that we're currently looking for the right partners for. This concept testing will be very detailed and in multiple states. Over the coming year, we'll be dedicating a complete hybrid diary study to study and iterate on the product as it is being used in the pregnancy journey, which is about a 9-month journey. So it may take up to a year to do the diary study. We also look forward to finding the right product market fit so that we can approach and tie up with government agencies like the Ministry of Education and Ministry of Healthcare in India to roll this out and actually experience the impact it will create. So here's to hope, because educating the mother has impact on generations ahead. Thank you.
Thank you very much, presenters. Well, I think we'll bring back Peizhong, but I just wanted to say you talked about generations, but also think the importance of the research you're doing, well done in India, has incredible relevance to a context around the world, not just in India. So your findings, I'm sure, can be applied to many more scenarios. We have some questions coming in now for the chat. Do we have Peizhong back with us?
Oh, yeah, I'm here.
Peizhong, because the first question came in for you. We'll start with that one. It's a question from Teresa, and the question is, what are the ethical considerations for replicating rather than replacing traditional methods? So how do you replicate rather than replace? Did you hear that question, Peizhong?
No, I'm sorry. Please.
Okay,
Pardon.
yeah, I'll repeat that. Yeah, the question is from Teresa, and she says, you talked about replicating rather than replacing. She asks, what are the ethical considerations, or how do you go about replicating rather than replacing traditional methods?
I think this project is about speculative design in the future, and it can be a little similar to the design fiction or something fitting to the future. The present the present situation, we can we think about not very much.
Okay, thank you very much. And I have actually, now that we have, it's interesting to see our three presenters from India. I'm not sure how you want to take the question, but I'll put it out to you. In a previous presentation, we learned about the importance of trust in working with people in the field. In your case in particular, you're also dealing on a topic of quite considerable privacy. So maybe you could speak a little bit about how you establish trust with working with people when you're doing design research on private issues. And we'll let you freely decide who would like to speak to answer that.
You want to go ahead, Priyanka, because you put the participatory research together? Yes?
No.
Your audio is off at the moment.
Yeah, audio is off, Priyanka. Should I
Can you hear
take
me
that?
now?
Yes, that's better.
Yes, we can hear you now. Yes.
So a huge part of our process was to collaborate with healthcare workers who have been dealing with these issues when it comes to communicating with pregnant people in rural and urban areas. A huge part was the rural area, which is why we made sure that once we had a doctor in vetting our information. She was making sure that the problems that we're targeting made sense because she dealt with all the issues that we were trying to solve. The trust was slowly built. We were the first team to try and do this for a lot of people had done it before. This was the first team that brought her along the entire process, right from the research part to the ideation. She was part of building the product throughout our entire journey, and I think it will be able to continue how startable it was. But this is the trust factors.
Yeah, I think the fact that we were all from different cultural backgrounds also really helped us connect. Some of us could speak the local language, and that helped too. Thank you.
Thank you. Yes, and you may know we had some difficulty in hearing the audio for the first answer there, but thank you for following up. We have one second question for your team. You talked at one point about the advances in technology and the mobile penetration in India, but then you talked about the need to go back to the hard physical prototypes of the calendar. So even though the technology is available, how did you find the willingness for your participants to adapt to that new technology?
What we tried to do is embed the technology mostly with the people who had access to it. So the app is mainly reserved for the doctors, and doctors do have access to technology. That is one. The other piece, which is the QR code, which is the first piece that's really embedded within the product itself, and it's meant for direct user engagement. The QR code is currently being used very extensively across the Indian ecosystem by payment methods. So everybody's now getting used to scanning a QR code and making a payment. So keeping that in mind, we did introduce it with some users, and the users did find it quite intriguing and to use it. So those are the two elements of technology which are currently part of this product. The app in the hands of the doctor is powered by AI and machine learning to really understand what is wrong with the patient. But the other piece of technology is it's a very user-ended, comfortable piece of interaction that's already popularized within the Indian ecosystem.
Great. Well, thank you very much again to our four presenters under the theme of human-centered technology.